Hello students, so welcome back to my channel. We were talking about the gastrointestinal pathologies, so let's begin. So today we are going to talk about the malabsorption syndrome. So there are actually 4 malabsorption syndrome we are going to talk about. The one is celiac disease, lactose intolerance, pancreatic insufficiency, tropical sprue, and the Whipple disease. So what is the malabsorption syndrome? It generally causes the diarrhea, steatorrhea, weight loss, weakness, vitamin mineral deficiencies. All of these malabsorption syndrome, they actually cause all of these, and the fecal fat can be screened by the stain that is known as Sudan stain. So if we talk about the celiac disease is actually a gluten-sensitive enteropathy, or it is also known as a celiac sprue. It is an autoimmune mediated intolerance against the gliadin, gluten protein found in wheat, barley, and rye, and it's associated with 2 types of proteins, and that is DQ2 and DQ8. The mnemonic can be dairy queen, eat too much gluten. It primarily affects the distal duodenum and proximal duodenum. Treatment is actually the gluten-free diet. It is associated with the symptoms that affect the skin, that cause dermatitis, herpetiforms. It's also decrease the bone density. It causes anemias, and it also increase the risk of cancer, that is the T-cell lymphomas. D-xylose tests also come abnormal, and serology IG anti-tissue transglutaminase is usually positive. Anti-endometrial and anti-diamylated gliadin peptide antibodies are also used to screen for the celiac disease. However, if there is a deficiency of IgA, then there is another antibodies that need to be checked. So histology shows 4 things. That is actually the gold standard. So they are flat and crowded. That means there is a biliary atrophy, there is crypt hyperplasias, there is intraepithelial lymphocytosis, as well as the lymphocytosis. So if we talk about the lactose intolerance, that is actually the lactase deficiency. The villi are normal, but it could be secondary to the viral infection. And in the lactase deficient lactose intolerance, there is actually osmotic diarrhea with decreased pH, stool pH, and the lactose hydrogen breath test is usually positive, that is more than 20 pico per minute, particles per minute. So pancreatic insufficiency is actually due to the chronic pancreatitis, cystic fibrosis, or cancer, and it causes a malabsorption of the fat and fat soluble vitamins as well as vitamin B12, and it will actually lead to the decreased bicarbonates and fecal elastase. These xylose tests are usually normal. And then they have tropical sprue that affects the people that lives in tropics usually, and it is similar to a celiac disease, but it responds to antibiotics, decrease the mucosal absorption, and affect the duodenum and jejunum mostly, but it can also cause the megaloblastic anemia due to folate deficiency. Then we have the Whipple disease. Whipple disease is actually the infection with this Whipple intercellular gram-positive organism. So PAS positive forming macrophages in the intestinal lamina propria. Cardiac symptoms, arthralgia, and neurological symptoms are very common and usually occur in the older females. And so they are actually the pulse of foamy whipped cream in the can. That is a mnemonic that is for this disease. Pass the foamy whipped cream in a can. Then if we move on, so if we talk about the macroscopic colitis, it's an inflammatory disease of the colon that causes the chronic watery diarrhea. It is most common in older females, as well as the mucosa appear normal, and it has a lymphocytic infiltrate in the lamina propria with intraepithelial lymphocytosis and thickened subepithelial collagen banks. So if we talk about the inflammatory bowel disease, the inflammatory bowel disease are actually of 2 types. There is a Crohn's disease, and then there is an ulcerative colitis. So Crohn's disease is usually present anywhere from the mouth to the mouth to the anus. So at any portion of the GIT tract can be affected, whereas the ulcerative colitis is usually seen in the colon only. The lesions of the ulcerative colitis extend towards the rectal also, and it has the continuous lesion. So ulcerative colitis hugs the rectum continuously. Crohn's disease does not affect the rectum, and it has skip lesions. The Crohn's disease has transmural inflammation, so that can cause the fistulas, it can cause the cobblestones, mucosa, creeping fat, as well as the bowel wall thickening, that is a string sign. So it causes thickening of the bowel wall. It can cause the ulcers and fissure, whereas the ulcerative colitis is mostly superficial. It fractures the mucosa and the submucosal only, and it can cause the friable mucosa and as well as the loss of ostration, and that can lead to the lead pipe. Then we have the macroscopic morphology of the Crohn's disease that leads to non-caseating granulomas, lymphoid aggregates, so non-caseating granuloma and lymphoid aggregates. And the ulcerative colitis actually cause the abscess, crypt abscess, ulcers, bleeding, no granulomas, and they are mediated, Th2 mediated. Then the complications includes the complications include the malabsorptions. Colorectal cancer is increased with the risk of pancolitis. And then we have fistula, strictures, perianal disease, and abscess that are more common with the Crohn's disease, whereas the colon can explode, perforate, megacolon, fulminant colitis, they are more common with the ulcerative colitis. You see blood in ulcerative colitis, bloody diarrhea is common there. Then extraintestinal manifestations, there is rash, there is eye inflammation, there is edema, oral ulceration, as well as the arthritis. Then we have some kidney stones and gallstones that is common with the Crohn's disease, whereas it affects the ulcerative colitis primarily affect the bile duct. The antibodies, A is for the anivir and anivir in the Crohn's disease, and A is CA positive, and P is for the pipe colon, and P is for PA and CA positive. And then if we move on, then the treatment is usually the colectomy is done in ulcerative colitis. Colon is basically removed, and along with that 5-aminosalicylic acid, mercaptopurine, and infliximab are usually given in ulcerative colitis. Whereas in the Crohn's disease, the steroids, antibiotics, azathioprine, and biologics are usually used. The disease activity is monitored by a fecal calprotectin that is used to differentiate between the inflammatory disorder and the IBS, that is irritable bowel syndrome. We are going to talk about more pathologies in the next video. Keep watching and don't forget to subscribe my channel. Thank you.